I believe when we left this, the honourable member for Northumberland Peterborough South had used up a whole minute of his time, so there's 9 minutes showing in debate. The honourable member for Northumberland Peterborough South.
Thank you very much, Mr. Speaker. I will, of course, correct the record there. It actually used up 11 minutes of my 20-minute time period there, Mr. Speaker. I hate to correct you, but I feel as though I'm compelled to retain the integrity of this House. Of course, today I'm continuing my speech on childcare. In the earlier part of my speech, I went through some of the challenges with the childcare system and outlined it. To that end, I'd like to, at this point, go through some proof points, and those proof points will be actual emails that I have received from constituents. So I will try and give this as clearly as unredacted as possible, but obviously for personal reasons and for names and other things, I will skip over that part. But so the first one starts, good evening. I'm hoping you can assist us with daycare funding. My daughter is a mother of 3-year-old twins. She has children in a daycare provider right now and was told that funding would be available by October. However, she has had no further information, unfortunately, and employees are unaware of when the funding will be available. As you can imagine, having children in daycare is costly. My daughter pays $100 a day. Is there somewhere I can reach out to answers? And we've tried very hard working through to the government to get this $10 a daycare spots, but to no avail as still to this day. I'm writing to you today as a concerned mother of an 8-month-old baby. I have been an RN for over 10 years. The state of availability of licensed daycare spaces in Ontario is appalling. She does say it is, and I'll read it all unredacted, good and bad. It is fantastic the government is working towards $10 daycare to improve the financial accessibility for all. However, the planning behind this rollout has been abysmal. Did the government not consider the immense increase in demand that could not be met with the already lacking spaces in the licensed childcare industry prior to the rollout? The wait lists were already lengthy. We added our child multiple wait lists at 20 weeks pregnant, being told that we might already be too late to secure a spot for him at 1 year for me return to work. So just to clarify that, so she put herself on the list at 20 weeks pregnant so that she could have a spot when the child, who was not born yet, was a year old, and was told that she was too late. I am now less than 4 months away from my return to work and have no idea when I can return to work due to the lack of daycare spaces for my child. As a registered nurse, I am eager to return to work to support people in my important work. I paraphrase a little bit because I don't want to give the specifics away. But may be delayed due to being unable to access appropriate licensed childcare for my infant. The plan for $10 daycare requires significant infrastructure for years prior to being able to achieve. Now, oh my, that is an insightful comment. In order to achieve something, you have to plan. My father used to say to me all the time when I was a youngster, if you fail to plan, you plan to fail. And I think that is borne out here. New centres must be built, RECEs must be trained, supplies must be purchased. Just paraphrase here because I don't want to give away the specific area. Our community is growing quickly, and so that need is even more acute. Both of these issues combined are compounding the problem with creating disasters for families who are planning for their children so they can return to work. I can only imagine how other healthcare workers or first responders are in the same situation. This is only compounding our healthcare and first responder shortages. I'm asking you to please advocate for the development of infrastructure to support this rollout. Also consider creating area-based lists rather than individuals. The next one. These are all relatively recent emails and just quickly pulled off by my staff. I am, once again, this person is pleased that there is, so they say, I am pleased to see in the media is finally reporting on the disastrous rollout of the Canada Early Learning Child Care Act. I am so tired of listening to the Prime Minister bragging about saving Canadians thousands of dollars in childcare expenses when I know this to be a fallacy. This became an issue and a concern for me in 2022 with the birth of my third grandchild in St. John's, Newfoundland. This was about the same time as Newfoundland signed on the federal program. $10 daycare sounded so promising. Little did my daughter know how difficult it was going to find daycare at any cost. At that time, my older daughter in Ontario was looking for daycare for a 3-year-old. She became number 90 on the waiting list at the local schools, publicly funded. And I would like to thank the member from Peterborough for advocating so strenuously on our behalf. Here's another one. I am a firm believer in the value of accessible daycare for all Canadians. But I also believe that parents should have the option of private care for their children. I realize a number of Canadians do not support tax-funded daycare. Many of these are people who don't value women's work and don't connect the dots when their hip surgery is canceled because there's no ER nurse available. My Newfoundland daughter became very active in an organization, I won't say to reveal it, to work for it and to advocate for childcare. There are so many liberal missteps for the Conservatives to address, but I think it is time to address childcare. As well as an issue for young family, it's an issue for grandparents as well. It's also a federal issue as provinces and territories are raising to concern. To quote her daughter, and I just paraphrase because I can't say the full thing in this House, I really wish the member for Carleton would come out and attack on childcare. I can't agree more. I believe it's time for Conservatives to take an even stronger stance holding these Liberals to account. And so you can see those are just a couple of emails, and I could read many more emails in the state of the childcare. Like everything with this Liberal government, they're great on photo ops, but they're poor on delivery. And just to put it in context as well, just to end off that, I also had a meeting last constituency week with the Autonomy South Monaghan food cupboard in Keene. And so we're putting, of course, in the context of parents and grandparents unable to find childcare. But in some ways, the crisis is even more serious for many Canadians as they are facing food insecurity as never seen before. I want to read to you the increase in numbers. They've already increased before I start this by significantly over year. But just in the last 4 months, the amount of children who are now being fed by the Autonomy South food cupboard has gone from 19 to 30 to 31 to 37. That's in an extremely small catchment area. But you see that the number of children going to a food bank at the Autonomy South food cupboard has doubled, and that's a story we're hearing across the country. So this government has promised a strong, prosperous economy. They failed. They promised $10 daycare. They failed. It's time for a common sense Conservative government.